And we'll give you a little bit of a sampling of some of the Handle with Care activities so that you get a real sense of how the program works with families and how it introduces important concepts around mental health promotion and how to promote mental health with young children. And I'll also share with you some of our challenges and some of our lessons learned, and of course where you can find out more about Handle with Care. And as Lee mentioned, there will be a time for questions, and I'll certainly do my very best to address those at the end of the more formal sort of presentation part of the webinar. So we know that every child is a wonderful, beautifully unique being full of potential and possibility, and this photo to me just really depicts that sense of wonder that children come into this world with. And parents and caregivers play a critical role in laying the foundation for a child's healthy and happy future. And it just so happens that this little girl is my niece's daughter, and right now some years have passed, and she's currently what I hear a real force to be reckoned with on the hockey rink. So that's one of her potentials and possibilities, is to be a fantastic hockey player. So so it's an important message for all of us to keep in mind, and I know that those of you out there who have connected in on this call are probably the biggest advocates of that entire message. So just to kind of think about the impact of parenting on children's mental health, we certainly know from evidence, decades-long evidence, that prevention programs promoting nurturing and stable relationships have significant potential to reduce the negative impacts of poverty and other conditions that negatively impact childhood development, healthy childhood development. We know that children with sensitive and nurturing caregivers in early childhood exhibit fewer behavioral and mental health problems and are more likely to be pro-social and succeed in school. Family environments that are warm, involved, and responsive contribute to children's social and emotional development and positive mental health. And we know that a key characteristic of best practice programs that support positive early childhood outcomes is the focus on helping adult parents and caregivers strengthen their skills so that they can support the healthy development of the children in their care. So just kind of wanted to basically set the stage with that, critical research that I know that you're all very familiar with, but just kind of putting that up front, that we know that it's so often those everyday interactions and those everyday small opportunities we have to connect as parents and caregivers with children, and in doing so we are supporting their mental health. And I think that's one of the key focuses of this program, is that we really help parents to understand that it is all those small things, those small everyday things, because of course, as we know, parenting can be and can feel very overwhelming at times, particularly as we parent young children. We also know that certainly, I'm sure many of you are interested in this topic specifically because you know there are a number of concerns around childhood and youth mental health. We hear a lot these days about challenges, impacts, different things impacting mental health. Some of it could be things like technology and media. We know that there's a loss of free play time. We know that there's decreased physical activity. We know that sometimes our own cultural and parenting practices can have an impact on things like resilience, self-regulation, emotional regulation. In some cases, it's a lack of loss of community in which has impacted our mental health and well-being in families. And so the list goes on. There's a number of things that are shifting and changing, and I know many of you on the webinar today share those concerns about mental health in families with young children. So one of the other things is that there are some new challenges, and some of them are brought about by technology, and I've just incorporated a few titles from parenting blogs. And so, things like, I'm Googling how to raise my child, and the person says probably not the best idea, but we all do it. Millennial dads turn to digital in their times of need. It is one of the first things we do when we have questions about parenting, for sure. And Google does have some answers, yes. Unfortunately, Google doesn't have all the answers. And parents are asking themselves, what did we actually do before we Googled these answers? And so one of the things I've noticed is that parents, certainly do have a lot of information, and I would say it's coming at them. When I think about when I was raising my first son, quite a number of years ago, there were much fewer, than it was pre-internet, so that's magazines or whatever information. You read the few books and you were good. But parents have really shared with us that they really do feel bombarded with advice and expert opinion, and so we've kind of like swung the total other way regarding the information, so that in some cases it almost detracts from their ability to kind of sit with and reflect with what's happening in their families and in their interactions with their children, to the extent that rather than being in those moments and in that interaction, they may in fact have a device in their hands and are looking for those answers. So it's kind of a real awkward kind of situation we brought ourselves to. But so these are some of the things that we heard from parents, and we heard from people who support families, and so we've incorporated those concerns and ideas and all of that into the Handle with Care program. So what is Handle with Care, and what is the Handle with Care program? We describe it as a set of simple, interactive strategies to help parents and caregivers, including those who work in early childhood settings, to promote the mental health of young children from birth to 6 years. So the activities primarily target those under 7, although we hear time and time again that the activities and things that people learn and benefit from in the program are really very applicable to older children, to other relationships, and to, and really having that sort of broader understanding as well. So that's another bonus that you'll hear about around Handle with Care. The other thing is that Handle with Care really uses a strength-based approach that assumes every parent and caregiver has problem-solving skills, potential resources, and that they do want what's best for the children in their lives. So it's really a message of supporting that, helping parents to really tap into their own resources and their own skills, developing those, and developing confidence in those. So that's just a brief sort of description, if you will, of Handle with Care, and we'll certainly get into more detail in just a few minutes. In terms of the story of the Handle with Care program, I just want to provide you with some context on that. So it was originally initiated by the Hinks Delcrest Center in Toronto, and at the time, Hinks Delcrest, which also provides treatment services to families in mental health concerns, was wanting to build and develop their mental health promotion program areas. And so they reached out across the country to people who are already doing mental health promotion with families of young children, and found basically four keener groups, and those you see marked here as the 4 original Handle with Care sites. So in Whitehorse, Yukon, there's a child development clinic. In Manitoba, it was the Winnipeg Regional Health Authority, and we also had sites in Ontario and in Charlottetown, Prince Edward Island. So those 4 sites basically consulted with their communities, including parents with young children, as well as the agencies that work with them, providing parenting programs, etc. And we asked them what they needed and wanted in a program that would support the development of positive mental health in families with young children. So I was part of this process, and it was a really important and valuable process that was done back in about 2009. So as a result of those consultations with communities, again, across those 4 sites in Canada, the community, and essentially this would be folks such as yourself who work with families, said that they really were looking for something in a program that could be fun and interactive, have that sort of ability to have that interactive content. They really asked for a variety of activities, and so some programs they had worked with in past were perhaps maybe using only one format or modality, And we heard from the community that they really wanted that variety. So things like stories, discussions, crafts, books, games, and videos. And we really took to heed that notion of having variety. And it really had to do with meeting audience's need and having a really interesting program that was engaging. They wanted flexibility in the delivery. So knowing how families are shifting and changing, and the way that they want information is also shifting and changing. They wanted to be able to deliver the program in small groups, but also in individual one-on-one situations. They were looking for something that was culturally safe and relevant, and having it be based on basically simple concepts that have big impacts. And this is probably one of my favorite parts of the program. They asked for training for facilitators that wasn't too costly or too time-consuming, and so we kept that in mind as well. And they certainly wanted to focus on positive mental health concepts that are relevant for all families, all parents, and so that universal application. And so what we did was put forward a proposal. The Hinks-Delcrest put forward a proposal to the Public Health Agency of Canada, who had a funding stream called the Innovation Strategy back in 2010. And the focus was for enhancing mental health of families dealing with risk factors for mental health. So the 4 sites mentioned were part of a large 5-year project and an evaluation. And so I was involved in that as well. And so the Handle with Care program was developed from that program, and it was actually an adaptation of an earlier program that was aimed at early childhood educators back in 2007. So we had some bones to start with, and we took that program, we adapted it to be delivered directly to parents and caregivers. We piloted it in all of the 4 sites across Canada, brought that information together, made some revisions, and it was implemented and then evaluated. So as you can see, the basis for Handle with Care is very rich. When you think about the different communities that were involved back in 2010 to 2015, we certainly reached a wide range of families. We reached many newcomer families, people from Indigenous families and Indigenous cultures. We engaged agencies that represented both Indigenous and newcomer families, and really just every type of family, urban, rural, and sort of across the board. So we had a great cross-section of families involved in that large study. So as I mentioned, the Public Health Agency of Canada funded a project from 2010 to 2015, and as a result of that, this program was developed. So the Handle with Care program is built on these 4 building blocks, which are, as we know to be, are distilled from the research on childhood mental health and well-being. So our building block 1 is building trust and attachment. Building block 2 is building and enhancing self-esteem. Building block 3 is expressing emotions, and building block 4 is relationships with others. So we really find it useful that we have these 4 very clear building blocks from which to sort of build our program and all of the activities involved. So I want to share with you now some of the key messages of Handle with Care, and these are really important. We share them in the facilitator training, and we also share them with the parents, because they're very important messages. So that is that young children's mental health is critically important in order for them to flourish, thrive, and grow into healthy adults. The well-being of parents and caregivers is also key to children's mental health and well-being. And it's never too late to build a healthy and trusting relationship with your child. So that really profound sense of hopefulness and looking to the future, and people who are living in challenging circumstances need to know that they can reach out for support and that there is a hopeful future for themselves and their families. So a little bit now just about how the program is organized. The Handle with Care facilitators receive 2 days, sometimes 3, depending on the day, basically 2 to 3 days of training, which prepares them to deliver the Handle with Care to groups of parents or caregivers or to individuals. So right now there are probably a little over 1,000 Handle with Care trained facilitators across Canada, and there are several master trainers who are qualified to deliver the facilitator training. So that would be myself as well as several others across the country, but we don't have a trainer-trainer model as yet. And so basically the program is set up there. You sort of see the format, and our next slide breaks it down into those pages. But just to let you know that the program is being delivered in the Yukon, Alberta, Manitoba, Ontario, New Brunswick, PEI, Nova Scotia, Newfoundland, Nunavut, and the Northwest Territories. So there's just a couple of provinces where we're looking to reach out to, and a lot of that just has to do with our capacity to do so. So again, we're really thrilled to be able to reach out to Saskatchewan today and get the message out about Handle with Care. And just so I don't forget to mention as well, you'll see in the slide right there that the Handle with Care is also available in a French manual. I don't currently have the capacity to deliver the facilitator training in French language, but just so that you are aware, the facilitator manual and materials are available in French. So each building block will have a similar structure, and in that building block you'll find an important key message. You'll also see a key message from the child's perspective, which is a really interesting and profound way to kind of get that message out to both parents and facilitators. So when you hear it from the child's perspective, it kind of gives you a little bit more, I guess, kind of grabs our attention. We have a section called What We Know, which is an overview of that particular building block topic research. We have a list of children's books, additional resources, and websites to help facilitators in their role. We have references, and we have also a summary handout for that particular building block. So each one has that structure. In terms of the activities, what's really important to know is that we again have the whole variety of activities. So again, we have videos, books, discussions, activities, games, etc. And within each of those activities, there are you'll find the same structure. So we have the aim of the activity, how long it will take, what you need to do as a facilitator, what do I do? We give you things to talk about, which are really important key conversation points. We have a section called Bringing It Home, which is intended to help you facilitate a process of where the parent and caregiver can bring home what they've learned. So sometimes that's a tangible thing of bringing it home, if it's a craft or something they've made or built or drawn. But other times it's and also as well, of course, it's bringing it home and bringing home the ideas, the concepts, the learnings, the teachings, and applying that to your family life every day. So that's one of the most important pieces. So we call that bringing it home. And the bringing it together is another important piece we added in after our pilot, and it was intended to help parents and caregivers connect one building block to another. So understanding how doing something around building attachment with your child actually has an impact on their ability, for example, to handle emotions. And we find that that's actually one of the bigger challenges for parents, is to see how these things are all connected. So that bringing it together is bringing it together in terms of the building block topics and how they go together, and how doing one thing can actually be a really important application that will help in a different area, whether it's building relationships, again, self-esteem, or handling emotions. So we've actually created 10 activities in each of the 4 building blocks. So that manual is kind of large, and that's because there's actually a whole collection of 40 activities, 10 within each of the 4 building blocks. So you'll find that even though within each of the activities there's direction about what to do and what to say and those kinds of things, it's not really scripted per se. We're very, I would say the process is quite well organized and guided, but it's not scripted in terms of you're not sort of reading out a specific script. But we do find that when facilitators have that really strong background and understanding and training, you know, they're prepared to lead the discussions in those groups and would refer to the things to talk about, for example, and we highlight what the key points are. So that's the format of the program. And so just in case you're thinking, gosh, 40 activities, that sounds like a lot, you have a choice. You have a choice of from those 10 activities in each of those 4 building blocks. So that means that it means getting to know your audience, your parent group, and finding out, you know, what you feel might work for them, what might be a fit for them, which ones perhaps maybe are culturally more of a fit for your group, those kinds of things. So we give the Handle with Care facilitators some choices about what they feel would work best for their group. So that flexibility was what was requested of us, and we've provided that. So the idea is that you wouldn't do all 10 activities when you're leading a session. A typical session would be 8 sessions, 2 on each building block, and in those 2 sessions you might choose to do 1 or 2 activities within each session. It just depends which activity you've chosen, how long it takes to kind of get through it and that sort of thing. But you might do 1 or 2 activities per session. Okay. So what makes Handle with Care unique? Well, here are some of the real highlights that we've picked up from the facilitators' feedback as well as the parents. And one of the biggest ones actually is the opportunity for self-reflection. So this one is really, really important, and I hear this time and again from people that our culture these days really does not allow us, or we've kind of gotten a bit away from self-reflection. So we all do this. We're standing in the grocery line, for example. What do? We don't just stand there and think. We pull out our phones. I mean, it's just, you know, it's just part of what our culture is of these days. And same thing walking home. How many people do we see kind of walking home from school or work, and they aren't just self-reflecting. Most often they're doing something. They're listening to music perhaps, or listening to a podcast, or they're looking at their phone, that sort of thing. So parents, like at the first few sessions, they're like, oh, like they actually do kind of take a step back, because they will say very frequently that, wow, I've never really thought of that, or I hadn't really sort of given that, you know, that same kind of reflection. So it's really important as facilitators to know that parents value that, even though it's something we've kind of gotten away from in our present day culture. It's a really important tool. Self-reflection is a really big part of resilience. It's a really big part of our problem-solving processes, and so without it, we kind of miss out on some of those things. So the other thing that makes Handle with Care unique is that it's very interactive learning. We have a whole variety of those learning methods. This picture that you see there is an actual group that I've had the pleasure of working with. And as you can see, people are very busily focused on their craft, it looks like in this particular case. But there's that really, really great coming together. So when people are busy with their craft, it's keeping them, they're thinking, they're reflecting, they're interacting, and they have that real sense of camaraderie with their fellow parents. So the flexible delivery is really unique to Handle with Care. So I underlined 8 sessions because the evaluation was based on an 8-session model, 2 on each building block. but some people have done 4 sessions, 1 on each building block topic, and we did say that Handle with Care can also be used on a one-to-one individual basis. So this is really important for, I noticed here in Winnipeg, where we have, for example, parent drop-in centers where parents may just be coming in for coffee. We do have some parent centers in elementary schools where parents, may not be able to or may not be interested in committing to a 4-session or 8-session model, but we certainly don't want them to miss out on Handle with Care and what it has to offer. So we've allowed for facilitators to share activities if it's appropriate, or information, anything from the program that they feel would benefit a family and benefit a parent. There's a really strong self-care focus in Handle with Care, and again, parents love this part of the program. We very often, as parents with young children, are, really find it challenging to find the time for self-care. So we have a lot in the program that supports that focus, and parents really valued it. Again, we're a very strength-based model and focus, so not deficit, not what you're not doing right, but looking at, hey, that really worked, hey, that really is something that's of value to my family, it's important to us as a family, and parents really like that part of the program. Again, the universal approach, it fits for all parents and caregivers, and yet it may be particularly important for families who have less support or who have less infrastructure supporting them in mental health and well-being, and so it's particularly important for them. And we did find that the training itself, the Handle with Care Facilitator training, which I mentioned is often 2 days of training, is itself capacity building. So facilitators learn about mental health promotion, the sort of broad range of things that support positive mental health, how we can incorporate that into our everyday lives, and then just how we, for our own well-being and also for all the families that we work with. So just want to say a little bit about the flexible delivery model. So just for clarity, again, I mentioned that in phase 2, we did an evaluation on the 8 group sessions. And so this would be like your sort of catalog version, if you will, of the program. And that's what the evaluation, large evaluation has been based on. And that you'll find that evaluation, a very brief summary on the website. And we just completed phase 3, in which we did include some 8 group sessions, but we were actually more interested in the success of 4 group sessions and some one-on-one sessions. So we were looking to include those in an evaluation, and that report has not yet been completed, but we're working on that. And so, we learned some things about that as well, which I'll share with you right now. So looking at some of that quantitative and qualitative findings, and this will be primarily from that first large research evaluation. We looked at 349 parents and caregivers who were involved in the program, and the Public Health Agency of Canada, who funded this research, was looking for communities at risk for mental health issues across the country, and so that's how these 4 locations were involved, including ourselves here in Winnipeg. So the research was a mixed method research design, and so this sort of indicates that, for example, everyone received a whole range of measures that were a pre-test, and then our controlled delayed intervention group happened, and we moved on to a post-test and a pre-test for our control group, and moved on. And so it kind of shows you the process of our evaluation there, and we did 4-month follow-ups as well. So involved in the evaluation were 48 communities across Canada. We did 21 focus groups with parents, and we did 7 focus groups with facilitators. There were the representation was 14% Indigenous families, 38% newcomer families. And so we can share a little bit more of that research there. Some of the parent measures, meaning there were one-on-one interviews with all the parents who participated in the program. And so there was a knowledge and beliefs of child development questionnaire, a mental health continuum questionnaire. We did a major depression inventory, a parenting sense of competence scale. There was a self-care questionnaire, and of course, as I mentioned, interviews and focus groups. So what did we find? And what were the outcomes? Well, in terms of mental health, we found that parents and caregivers had improved positive or flourishing mental health, and that there was a reduction in symptoms associated with negative mental health. And in this case, the term languishing is from the measure that was used, the mental health continuum short form. Parents and caregivers had more positive feelings about themselves and people around them and the environment. In terms of a parenting sense of competence, there was confidence gained in their parenting practices, increased positive feelings about their relationships with their children or the children in their care. And the last major point was around self-care. So their levels of self-care improved significantly from pre-test to post-test. So some of the things that I think it's really important to have the voice of people who were involved in the project and in the research, and so I want to share some of that with you right now in terms of the key changes in parenting practices from their own perspective. So for example, around expressing emotions, which is our building block 3, one person says, I had to kind of take a step back and really acknowledge the feeling words and let them understand this is frustration, and stopping and talking with them instead of blowing up. And another person says, when she makes me mad, instead of yelling or getting angry, I stop and think about how it's going to make her feel, depending on what I say. So that's empathy in action, and how a program like Handle with Care, for example, can, again, help parents to reflect and to understand those links. So this is a reflection on how a parent was impacted around the building trust and attachment building block. And this parent says, I'm spending more time trying to identify the problem with my children, and I'm also spending more time trying to recognize their emotional needs. Again, on expressing emotions, building block 3, giving her the tools to manage her own emotions. So by helping her manage hers, I in turn manage mine. And she also gets the benefit of my example, to see me struggle and take a deep breath so that she can understand it's not just children that experience the struggle. So I think that's a really, really poignant quote and experience that someone had in learning about how we all experience emotions and we all experience challenging emotions. And this program is one way that we can introduce to parents healthy ways to handle those emotions, cope with them, and that a large part of that is how we share that with others. So around the self-care and well-being outcomes, self-care and wellness practices improve significantly in the parents and caregivers. And so this idea of being good to yourself is really, really important. And some of the reflections around that were taking more time for myself is helping my parenting in a positive way. I have learned that in order to take care of my child, I have to take care of me. And it is a big thing that I'm starting to take care of myself more. Can't really take care of him or my other one if I'm not taking care of myself. So helping parents to make those connections again, really valuable part of the program. And one of the fun parts about the self-care aspect of Handle with Care is that it's a lot of fun. So we're really encouraging and modeling throughout the entire program, helping parents to learn creative ways to practice self-care. So developing that awareness, we have a self-care assessment tool as part of the program, and that helps them to think about all the different ways that they might use self-care practices in promoting well-being. So for example, music, movement, different mind or hand games, finding things in your life that help you feel nourished. So for example, nature might be something that helps you feel nourished, and people were able to identify that and then find ways to incorporate that in their everyday lives. Reflection, gratitude, self-compassion. So activities like these really encourage parents to think about all the different ways, really broadly creative ways that we can practice self-care and that they need not have a cost. So of course that was a concern for parents, and it is for many of us. Also time, how much time do we have for self-care, and do we have time for it? And so we help parents to think about the fact that yes, they do have time, and here are some great ways that are just incorporated in our everyday practice. Some of the quick things that we incorporated were things like finding 3 good things in your day. So at the end of a day, just thinking, and if you have time, to jot down 3 good things that happened in your day. Another way of thinking about that is just the what went well, the 3 W's, what went well in your day today, and reflecting on that every day helps us and has been scientifically proven to have an impact on our psychological well-being. So some of the additional qualitative findings around emotional regulation, adults as well as child self-regulation, a reflection is, I've learned to stay calmer, and if you need to take a break, take a 5-minute break. It's not going to be the end of the world, and to keep a positive outlook on things. Improve family relations. I am trying to be more compassionate in my relationships with my husband and my older child in front of my younger children so that they can see how that works. And also enhance knowledge on child development and mental health. So it reminded me to communicate more on my child's level and to help them talk through their feelings. So just some additional reflections from parents. So what I hope to do now is just to give you a sort of a quick taste of the different of the 4 building block topics, and a little bit of a sampling of some of the activities that are part of the program, just so you get a bit of a flavor of how the program looks. So we'll start with the building block on trust and attachment. So one of the first activities is called an attachment mobile, and it's an original story from our Yukon partner, Leona Cornier, who wrote a beautiful story about putting beads on a string, a simple string and a stick, and creating a mobile. And it was a story that was passed down to her. The story includes a reflection from the grandmother who passed down the idea to remember and to be present in those moments of connection, and to recognize them, to cherish them, and then have a sort of visual representation of them by putting a bead on this mobile. And so sharing that with your child, of course, depending on their age. And so the activity is really well received. People love the idea of having those tangible beads to put on their mobile, reading the beautiful story, and just reflecting on that throughout their week and adding to the mobile again and again and again. And the activity has been adapted. Some people use the beads. Adding the bead to drum making has been really successful in some communities and very meaningful as well. And just, thinking about an example of this activity, how might your day and the day of your child be different if you were able to have a really sort of long, enjoyable kind of hug each morning before you set off for your activities, work, or school, and how you feel about that moment and how it might fill your tank essentially for the day. And parents will then think about, wow, I did that every day this week, and it just set the tone for the rest of our day. Like, we just felt so much more connected and felt so much more, less caught up in the busyness, etc. So, I don't have the full story here. You can find the attachment mobile story, a little chunk of it on the website. But just wanted to give you a little bit of a flavor of the kind of activities that are part of the Handle with Care program. Some of the adaptations then, what activities could you do to add attachment beads on a mobile for a toddler? So depending on the parents in your group and the age of their children, we ask them to think about things in, real flexible ways for their entire family. What would that look like if you had an infant? How could you savor those moments, and how could you share those moments? What would it look like if you had a toddler or preschooler or even an older child? Even though this program is focused on the younger children, what about older children, and could you adapt the program in ways that make it meaningful for older children? So as I mentioned, the bringing it together has prompts and clues about how to link each building block. And so in this one, a strong attachment relationship is built on many small positive interactions and connections made throughout our day as parents and caregivers. And this healthy attachment relationship also contributes to a child's positive self-esteem. So just again, thinking about that hug, how good that feels to have someone love you and care for you no matter what, and feeling the warmness of that hug throughout your day, and how good that feels as a child. So just a little bit about building block 2, building and enhancing self-esteem. So here's a fun activity that we call temperament tidbits, and what we do is talk to parents and caregivers about what temperament traits are, what does temperament mean, how we all have sort of a temperament in our lives, and there's a little bit of change as we go on in life, but that we kind of are a certain way in our lives. And these are some of the things to think about in terms of, what is sort of our comfortable activity level, the way we are sensitive to things or not, or are we low-key or more stronger kind of people? Is our mood one that tends to change a lot, or are we sort of the person that's more level in mood and all of that? And so it really helps parents to build their self-awareness when we talk about this thing, this idea of temperament. But then we ask them to do this fun activity of choosing one of the chairs here that best fits with your temperament and share why you made that choice. So what we do in groups is kind of put them on a piece of paper and kind of tack them around the room, and parents actually go over to the chair that they feel kind of represents them, or you can just have them on a table. And it's really fun for parents. They think about, what am I like? Do I kind of identify more with that soft beanbag, flexible kind of chair, or am I a person that would actually kind of fit more with that task chair up at front top, where I can kind of zoom around and get to stay on task and be kind of ready to roll, so to speak. So it's really fun to hear parents talk about why they identified with that particular chair, and helps build their self-awareness around their own temperament. And then in the next part of the activity, we ask them to think about a chair that best describes the temperament of a child in their life. So this is where the fun starts, because then they're going to think, where does my child kind of fit in? And so they may, of course, stay at the same chair if they feel it's the same or similar, but they often do go to a different chair, and it really helps them have that sort of aha moment about the differences in temperament that we all are. And, having the ability to talk about that and understand that more is really kind of an important, creating those important insights for parents. So we talk about how children's temperaments impact how they express emotions, again, linking it to other building blocks. We discuss strategies that parents and caregivers can use when their own child's temperament, could be different from their own. And so we help them to bring that together by linking that back to things like that relationship. So when we have a little more tolerance and understanding for our child's temperament, for example, we can then build a bigger appreciation for who they are, and also build a stronger and a more trusting relationship. So a little bit about expressing emotions, which is another really fun building block. And again, remember, there are 10 activities in each of these building blocks. So I'm just kind of pulling from one of those activities to give you a little bit of a taste. And this one is called Breathe and Stretch. So we pass around a small, smooth stone, and we have people think about a time when they're anxious and what does that feel like for them. So this does a number of things. It helps people to understand that we all experience anxiety, and feeling anxious is a very common feeling, and we can experience that sometimes in similar ways and sometimes different ways. But it also gets at that sort of physical sensation. For some of us it's feeling tight muscles. For some of us it's feeling a little bit queasy. Sometimes our heart's kind of pounding, those kinds of things. And when they go around the circle with the stone, people identify and understand that we all experience that, and that there are ways to cope with that. And so we have some discussion around that, and a little bit of sharing about that, and then we talk about techniques to cope with that. So these are techniques that we can use ourselves and with our children, and so the blend of learning along with our children is really prominent there. And we help them to learn new ways to calm their bodies and calm their minds, such as breathing, stretching, and those kinds of activities. So we have different breathing exercises, which some would be things like the blowing out birthday candles using your hands and blowing up imaginary balloons in the hot soup. These are probably familiar activities that you've learned and share with parents in other programs, and there's other ones that are included in our program as well. So bringing it home has to do with how calming strategies can really help children work through different emotions and lead to emotion regulation. So in one of the reflections that I just mentioned a few slides back, you heard about a parent who really tapped into that and helped be present in those moments to recognize when emotions were getting strong, and just being able to take a step back, take a breath, and then feel like they can respond in a way that's probably more healthy for them and for their child, and being able to use that over and over again. The fourth building block is relationships with others, and so all of these activities have to do with who we are as people, how we connect to others, how we create a sense of community, and any of the topics are about building those really strong relationships, and a lot has to do with our values and what we value in families. So this activity called Family Nest helps us think about and reflect upon traits and values that you believe are important in your family, or that you'd like to be important in your family. And so just on that note, all the activities really, again, are written and in a very hopeful sort of way for parents. So if it's not something they feel they're achieving right now, it's certainly something they can work toward. And tomorrow's always a new day, so that real sense of hopefulness and forward thinking is always a part of the program. So as in the picture that you see here, there are all kinds of things people reflect upon in terms of their values and traits that they believe are important in their family, having a sense of belief or courage or value, peace, support, harmony, etc. So parents really, again, value sitting down and thinking about this in a really tangible way, and they can actually put that value on their stone and have a whole nest of values that they can take home to treasure and think about and share with their families. And so the aim in this particular building block is to support participants and help children acknowledge and celebrate shared values within their family or group. Participants reflect on those traits and values, and they can keep their nest on display. And I know in my own home I have these kinds of things out for myself as those sort of constant reminders to remind me what's important to me in my life. So in the bringing it together, we give opportunities for appreciating family values that can improve and secure relationships. Respecting and accepting helps us to express our emotions in a positive way. And again, things like positive self-esteem, can be contributed to as well. In the bringing it together section, we encourage facilitators to basically choose one, so they don't have to share it with all four, but just kind of honing in on one particular aspect to share that kind of links the building blocks together. So that concludes the part of the presentation where we talk about each of the building blocks and kind of give you a very, I know it's a very little bit of a sampling, if you will, of the building blocks, but just really want to get at the idea that Handle with Care is about those simple interactive activities that kind of get people thinking. So we wanted to keep it really simple, but it's really, they're actually really profound in terms of how it challenges us to think about things in new ways. So that's what we typically see in the program. Some of the things that we learned are, parents with young children seem a bit less interested in attending group programs. I know that it's been a bit of a challenge for some of our programs here in Winnipeg. I'm not sure if it's the same in your community. But I think some of that has to do, again, with sort of a little bit of a individual focus, a little bit of, again, people may be reaching out in different ways through technology and so forth, and so they're maybe not as interested to go to a group. I know I've heard young moms talk about how they are reluctant as they don't want to be sort of in an environment where they may be feeling judged and that sort of thing. And so there's a little bit of some of the barriers around just group programs in general. So those are something to keep in mind in terms of how can we overcome that and continue to build a good community for families to grow up in, essentially. Although I do see an exception for our newcomer families, at least here in Winnipeg, and also in southern Manitoba, there's quite a number of newcomer families, and they really do love the group coming together sessions, and so they've really actually embraced the group programming and group Handle with Care. Facilitators need to focus their efforts on facilitating a process of reflection with the parents and caregivers from that strength-based perspective. So I did notice that for some of our facilitators, they've become more accustomed to kind of a teaching model, and this really is a different program than that. So that's just one of the things we've had to kind of remind ourselves a little bit from time to time as facilitators, that it's not a teaching kind of a program. It's more about providing an opportunity, providing a facilitation to help, to provide an environment where parents themselves can kind of reflect on things and just kind of putting things out there so parents can think about it for themselves and come to some important conclusions for their own family. Which is really a very empowering process for families and parents. When the program is facilitated as intended, participants experience quite profound and meaningful insights from very simple activities. And this I can definitely say I've experienced time and time again. When we give people the opportunity, when we don't rush them through an activity, when we really kind of just sort of let them have time to think about it and think about how it impacts their family, their simple activities can turn into really important and really meaningful insights. As I mentioned earlier, while the program can be delivered flexibly, our data is really telling us that the 8-week delivery model has greater benefits. So the benefits that come from that 8-week group delivery model has to do again with developing that community over 8 weeks, developing the comfort level, the rapport, the camaraderie, the shared learning. All those things are sort of additional pieces that come with that 8-week delivery model. And so while people can certainly benefit from one-time interactions, one-on-one interactions, and the 4-week delivery, or even a one-off session on a particular topic, which is what some people have done here to integrate Handle with Care in existing sort of weekly get-togethers that parents have. The 8-week delivery model is sort of the best practice version. And the program is aimed, as I mentioned, to parents of children birth to 6. Many parents are able to transfer their learnings and skills to other relationships within their family or with friends. So just to give you a little bit of an idea of the agencies that do have Handle with Care trained facilitators. Here in Winnipeg we have, and across the province, we have parent-child coalitions, and so those coalitions and their partners have been trained. Early learning centers, family resource centers. We also have women's health clinics, women's shelters, child and family service agencies. Some offer prevention programming that they've also integrated Handle with Care. Pregnancy and family support services, Canadian Mental Health Association in some areas, Aboriginal Head Start, and Aboriginal Health and Wellness. So just a sense of some of the agencies that have taken up Handle with Care and are currently delivering it and implementing it in their communities. So just one more parent reflection about Handle with Care. I think that you sometimes doubt your parenting abilities, that you're doing the right thing all the time, and I felt by the end of it, the Handle with Care program, that it kind of just made me feel better about the parent that I was. Made me realize that I'm doing a lot of the things that are in there. So that's a really important reflection that, again, as I mentioned at the very beginning of the presentation, where parents, have those doubts and they're reaching out, they really want to help. We really want to help develop their own sense of agency and trust in what they're doing and be able to kind of self-reflect and understand it from what's important to them. A facilitator reflection, they were very comfortable with each other. They were a very trusting group, even though we had a lot of variety in personality, socioeconomic background, and education. It was amazing how they were learning from each other in a way that you wouldn't expect. So that's a reflection from a Handle with Care facilitator, and I think it really speaks to how when you get parents in a room, at the end of the day, they all really want what's best for their children, and this is a way that brings them together on that point. So at this point, just to share with you a little bit, I mentioned that there are a few folks in Saskatchewan who have had the Handle with Care facilitator training, and so I'm going to invite Nicole just to speak a little bit about their experience there. There has been also, I will mention, there has been, I think, one, if not two, folks who have come to Winnipeg from Saskatchewan to take Handle with Care, and so they are also folks who have been involved from Saskatchewan. And the Handle with Care was also part of a session at the Saskatchewan Prevention Institute Prevention Matters Conference a year ago. Myself and Sherry Armstrong presented at the conference, so that was a great opportunity to deliver it there. So I think I'll hand it over to Nicole to at this point.
Okay, you can hear me okay? Okay, good.
Mm-hmm.
So yes, I'm Nicole, again with Battle River Treaty 6 Health Center. July of 2017, myself and 11 of my coworkers took the Handle with Care 2-day training. We were extremely excited during the training and afterwards because we thought it would be an amazing fit for the families that we serve. So soon after taking the facilitator training, we kind of thought, what's the best way to get this going and move it forward so we can bring it out to the families? So we decided to make 2 Handle with Care kits. And what's really nice about this, the manual, it has a CD that comes with it, and it has all of the 10 activities laid out on the disc for you. Of course, some of them are books. We had to buy a few books and things, but it was nice. We could just print out, when you're talking about emotions with kids and stuff, there's an activity where it's all these different facial expressions of children and stuff, so you can just easily print those off. We laminated a bunch of the games, the activities. We made crafts, collages, everything, and then we grouped each activity in each building block, and we have them in a bin, and then we can just easily the day before, when we know that we're doing building block 1 because we're starting a session with a group of parents, it's very easily just to grab what you need, grab your manual, prepare, and then go out and facilitate the activity. We have done it normally in 4 sessions. That just seems to work better for the people that we serve. In each building block, we always do 2 activities, It's normally 2 hours long, so that's not too long for people to be there. I've done it on alone by myself, but a lot of times out in the communities, we've always had two facilitators because it's just nice to work together and bounce things off with one another. And it's just been extremely well received by um, the families. So, like I said, we serve 7 First Nations communities. So, our community health nurses that are facilitators, they went out and did it in each of those communities. And what's nice, after each building block, there's a very simple, easy to understand evaluation that you hand out at the end. It takes like 5 minutes, 3 minutes for the mums, the dads, the caregivers to quickly fill out about their experience about the group. And it's been nothing but positive feedback. I just wanted to kind of share some of them, which I thought were really nice, was that some of the families said like they liked the togetherness of the program, like no one was singled out. The activities are relaxing. Um, you notice in these groups there's a lot of laughter that's coming out of it. There's a lot of sharing. There's a lot of really rich discussions. And as a facilitator, sometimes you might feel that you might get a little bit stuck, but what's nice is that it's so well laid out for you. They have times when people are doing the activity, if things aren't, the conversation isn't really moving, they have like little thoughts that you can throw in there, questions that you can ask so that the conversation keeps going and people are continuing to share. One of the persons said, wrote in one of my evaluations, they said, I thought the craft was going to be lame, but as we went through it and Nicole asked questions, we were reflecting and it actually became very meaningful. So it just kind of says, a lot of what Laurie has said, where yes, they are reflecting um, as a parent themselves on what they're doing wonderful already, but maybe what else can I do? What else can I incorporate into my life, my child's life, so I'm continuing to promote that positive mental health for my child. Um, Again, too, I'll just kind of quickly say it is so nicely laid out for you. Um, you're doing everything together as a group, so it's very supportive, it's very warm, it's very relaxing, and people get to walk away with a nice experience. They also get to walk away sometimes with some handouts that just kind of remind them about what they learned, reminding them about, hey, what am I going to work on when I get home with my child? And then also just things to practice for themselves, like whether it's doing those chair yoga stretches for themselves for self-care, um, or going on YouTube if they can't afford that book about have you filled your bucket today. Maybe they can go on YouTube and have that book read to their child with them. And it's just very impactful. It's a very strong and worthwhile program to share with families. And we're looking forward to continuing to run some more. We've already run it 9 times here in North Battleford and the surrounding areas. And then I'm booked already to run another 2 starting in October and then another one in January. So thank you, everybody.
Thanks, Nicole. I never get tired of hearing, parents' experiences and what it means, what the program has meant for them and the opportunity to share. So that's just beautiful that it's, as you say, not only as individuals, provided that support and learning, but to be able to share that and really feel that sense of community building as a result of the program. That's really really good. So thank you for sharing your experience. And
You're welcome.
It was a real pleasure to go to North Battleford to meet all of you and to do the training there. So just a couple more things to add, and then we can certainly open it up for questions. Your reflections really made me think about a story I just recently heard about Handle with Care here. And so downtown we have a agency that works with newcomer families with young children in particular, and most of their staff have been trained in Handle with Care. They really find the program an excellent fit, and so they have satellite places all over the city that work to support newcomer families, a lot of them in schools and so forth. But there was a particular gentleman, one of the facilitators was reflecting that there was a gentleman who was very new to Canada, new to English language, etc., but did the activity on the attachment mobile. And so again, when you said that, some of the activities, you think, gosh, like, is this guy gonna, do this activity, or is he gonna think it's lame? What a great word. And no, he thought the activity was so profound. He just felt again that the idea of doing something tangible, physical, and then bringing that to that meaning was just really important. And it just so happened that there was the woman that was at the particular, I think she was one of the volunteers at the site, was a First Nations woman, and she had an opportunity to kind of chat with him about his mobile that he had created, and so the facilitator was witnessing this beautiful sharing and this moment of connection and finding common ground in their, what some of us would perceive as being very different experiences. It just was a really beautiful way of how Handle with Care brought people together. And as far as the Canadian context, I mentioned the different sites, and so some of the things that have happened recently with funding around early learning is that the Yukon, just wanted to share with you, the Yukon had funds made available to them to expand Handle with Care last spring significantly, so that was wonderful news for us. And also in Prince Edward Island, they've got a large investment from their provincial government to deliver Handle with Care and support it over the next few years. So those are just some really exciting advancements for us as part of a program. Just wanted to share that with you. And also wanted to acknowledge the Public Health Agency of Canada for the funding and support of the 3 phases of the Handle with Care project. You can find a little bit more information about us on the Handle with Care Canada website, and I will keep my email within the presentation, so you can always find myself, or if you don't find it there, you can always access it through Lee Hinton as well. And I believe we are ready for questions.
Thank you, Laurie, and thank you, Nicole. So while we're doing questions, I'm also going to be running a poll on your computer. So I'm going to switch over. Sorry about this. This will take 5 seconds. Laurie, I'm going to switch over the control of the computer back to me. And if you could answer the questions on the screen, that'd be great. Does anybody have any questions they would like to ask either Laurie or Nicole? Okay, we have a few questions for the actual review or evaluation. So I'll be on the line for a while, but definitely please answer the questions as you go, and none of it is actually connected to your name.
Lee, am I supposed to be seeing questions somewhere?
No, because you're the presenter.
Okay, so you'll let me know what the questions are?
I will let you know. You don't need to fill it out because as the presenter, you don't need to.
you'll let me know if there are any questions.
So the questions, everybody, as we've already mentioned, are to be shared in the chat box. So everybody should have a chat box on their screen right now.
So while we're waiting for questions, I might add that is it okay if I add this in now, or should I wait, Lee? I was just going to say that the facilitator training, as I mentioned, is typically 2 days. It's very interactive. We get all of the facilitators right into the activities. We provide the manual, as Nicole mentioned, is very well laid out, has all the pieces that you would need. Then you can prepare some of the actual tangibles that you might need for the activities. But the facilitator training for sure is very hands-on and interactive.
Okay, and we have considered bringing a facilitator training to Saskatchewan. And if that is something that you're interested in, you can give me an email. And everybody here should know my email already. But it's lhinton@skprevention.ca. And we will see about setting one of those up. There is a cost to participants. We wouldn't be able to bring it in for free. But definitely, if you would like to bring it into the province, please get a hold of us, and we'll try to see what we can do for people. We have one question. Is there coverage do you get coverage to cover the costs when you bring interpreters into the group session? Either Laurie or Nicole, can you answer that?
Well, there are a number of groups, as I mentioned, newcomer groups, and it's the agencies that are delivering the program that incur any costs per se in terms of delivering the program. So there isn't any particular funding that we can offer to all the different facilitators and the groups that they offer. There was during the time of the research when we had funding from Public Health Agency. And at this point, we're obviously in implementation where we're scaling up, where we're out there training facilitators who can then immediately deliver the program in their community. And so but some of the creative ways, I guess, where agencies have overcome barriers with things like potential barriers with things like language is really just kind of working together and also looking at what resources you have in your community. I know the agencies here have been really strong on working in partnerships, so finding ways to either pool resources or bring people together. They do provide some. They have actually a fantastic model here where they have parents and caregivers who have been participants in the program. If they're interested, they can gain more skills to become helpers and then co-facilitators, and then actually take the facilitator training. And all of these people are multilingual, so they, for example, can then bring that language into the group and be an interpreter. So it's a really neat model to build the capacity within their own agency to make sure that the program is accessible to the families that they serve.
Thank you. Another question is, sorry, I'm just moving up here so we do them in order. Another question is, would it be possible to share the audio? And yes, it is. All these are recorded. So that was more of a question for me. Someone asked, what is the prerequisite to take the facilitator program? Or is there a prerequisite?
Thank you for that question. Yes, that's a great question. Thank you for raising that because it's not in my presentation. Basically, we encourage people to take the facilitator training who have some early childhood education background. So we kind of, it's a, self-monitoring in terms of people need to have some knowledge of childhood development and some experience in leading groups. There's obviously some, coaching around the facilitation, etc. But the program, the 2-day Handle with Care Facilitator training is really focused on the content. So we assume that people are coming with that bit of background and also a comfort level around leading groups, because we simply don't have time to sort of start from square one around those particular skills. But I can say that the folks who have taken the training, come from really, really diverse backgrounds. Some do have post-secondary education and early childhood education. We've had people with, psychology, sociology, nursing, any of those, social service type backgrounds, etc., become facilitators. So that helps to really round out their skills as a facilitator. But then some of them are people who have been involved in facilitating groups. I think particularly in some rural areas where they're a person who has just a lot of hands-on experience and is really has learned on-the-job training per se, and has taken a lot of workshops and trainings to have themselves be prepared. So basically, if a person is prepared and ready to deliver other parenting programs, this one is probably going to be okay for them as well. But we do certainly recommend that they have some background in the early childhood, sort of broad area. But thank you for the question. That's great.
Okay, and sorry, scrolling down to see what the next question is. Do you feel that this program would be helpful to families with children with behavioral problems or ADD and ADHD? It seems like it's something that would require a lot of focus.
Okay, so is the question referring to the parents who may have?
Would have.
Okay, so I would say yes for sure, because it actually encourages people to really get things down to sort of a basic level. It helps people to, again, what we call maybe take a step back, or to kind of look at things like behavior and those things from a more, relational perspective, and a more, emotional regulation sort of, looking at what supports emotional regulation and those kinds of things. So I think that it actually would be beneficial for families, and certainly lots and lots of families have benefited from it, who have children dealing with various behavioral problems, etc. So if you think back to some of the quotes that I mentioned, those are the kinds of things we typically hear, and that is, again, that being able to, even if you looked at self-care, for example, people, who live with challenges every day really need to find ways, and we need to support them to find ways that helps provide self-care, because it takes a lot of energy to look after kids with differing needs. So I think those are the kinds of things that would definitely be a fit for families dealing with all kinds of different issues.
Okay. And someone else asked if, when you did the groups, if you provided childcare.
It's really a couple of things about that question. So first of all, sometimes children are actually involved in the program. So nobody asked the question about, are children present? Normally, or sort of typically, I should say, the people in the groups are just the parents, but actually some of the activities, for example, they are children's books, as you mentioned, which are part of the program. So those activities and a couple others actually lend themselves to children being present, at least for part of the program. It's not a requirement or anything, but if you're in a situation where you don't have childcare, you could probably pick activities that would lend themselves to those young children being present. And certainly there have been lots of situations where, again, without childcare, children are present. Ideally, there's childcare, or there's childcare off-site or at home provided. And so that it's up to sort of, again, the site that's offering the programs if they have the capacity to provide childcare. Again, we've seen everything from childcare provided by an agency, volunteers, community people, or again, just sometimes people are able to have babysitters at home, childcare at home, that sort of thing.
Okay.
But it's a good question because it got us to thinking about whether or not the activities, lend themselves to having children in the group or not, and certainly some do.
Great. We have a bunch of people who are typing right now. I did put down, if you need a certificate for attending this, please send me a request at my email address. Please don't add it to the chat box because I won't be taking that information from here. So please send me an email, and I left the link there. And it will take a month to get everybody out their certificates. I'll need your full name and your email address. There doesn't seem to be any more questions at this time, so I'd like to thank both Laurie and Nicole for joining us today and giving this presentation. I think it was really worthwhile for everyone who attended. I'm getting some good feedback and definitely some people who are very interested in possibly doing a facilitator's training. So that's a great thing, and I'll be in touch with you, Laurie, to try to set something up, hopefully.
Well, that would be wonderful. I just want to thank everyone for joining us this afternoon. I really, really appreciate all of you taking the time to hear more about Handle with Care, and would love the opportunity to share the program with you.
And I'd like to remind everybody that the next webinar will be taking place on October the 16th. The link is the exact same one you used today to get into the webinar. And the next one is on self-regulation and parenting by Connie Herman, who's our Nobody's Perfect coordinator and also has taken the self-regulation course to be a facilitator in the province through Stuart Shanker, who, if anybody knows, is a very famous researcher in the area of early childhood mental health. That will be running from 1:30 to 3 p.m. on October the 16th. Thanks, everyone. If you haven't added information on the polls, if you could please do so, and have a good day.